what that meant. It meant that people who had been prevented because they hadn't any money, being able to go to see a doctor, being able to go into a hospital and receive treatment in a way that's not even available today. You can have all the technical advances in the world, but if you start to introduce policies which say that certain sections of society will not be treated from the cradle to the grave, then you're going backwards and not forwards. And in 1947-48, we had, for the first time, a National Health Service that at least was the best in the world. It was a health service that if you required a drug, you got that drug free of charge. You got it free of charge. And it's interesting that we've already now, for the first time, seen parties who are not socialist, like in Scotland, being committed to introducing policies where you won't have to pay for drugs. In other words, in the English establishment, there's been a movement backwards, away from the National Health Service. The establishment, for example, of trusts, of primary care units, and of the system that now operates in what was the National Health Service is clearly a part privatisation programme, where doctors at local level, that's GP level, where hospitals are now operating on the basis that they've got to treat the budget first and then possibly treat the patient after. Please don't anybody try to say that that's not true, because we all know that it is true. We've seen it. We spend less a day on food in a hospital for a patient who needs to be fed properly than we do in, say, the school meals system. The school meal system in a day provides more money than we provide for in a week in the hospital. Now, you know, these are staggering statistics, but quite honestly, they're appalling. I can remember back in the 1950s when the food in a hospital was of the highest standard. Today, it quite frankly is like a rundown motorway cafe that would be condemned even by the health inspectorate. It really is appalling, and some of the food that's even served up is inedible. But far more important, of course, is the treatment. Far more important is the fact that we've got waiting lists which have not been reduced at all. They've merely been manipulated. For example, when Labour came to power in 1997, what they said was that they would reduce waiting lists from the year to 2 years down to something like 6 months. They did nothing of the kind. All that they did was they started to count the waiting time from the time when the consultant gave you a date and put you actually on a waiting list. Now, the time from when the GP referred you to the time when you saw the consultant could have been 6 to 9 months. By the time the consultant saw you and then put you on a waiting list, you were going up towards a year, and as a result, the waiting lists are nothing like the 6 months that they pretend that they are. In certain circumstances they can be reasonably okay, but the variation between one hospital and another is almost a comparator with what's happening in our education system. Here we are in the year 2008, and we still have an education system which is quite frankly a disgrace, where if you live in one part of the country, or if you can afford to pay money, you get the highest quality of education. If you live in another part of the country, or you can't afford to pay, you quite frankly get a rundown, second or 10th rate system. Now that is not acceptable. There is no reason on earth why all our children and grandchildren should not have the same opportunity to the same standard of education, irrespective of where they live. And in doing nothing to advance that cause, what we have achieved is a nation where skills are being lost, where we're not developing anything that really represents manufacturing or innovation. You don't have to be a genius to look at what's happening at the present time when you see newspapers say, well, we're getting plumbers from Poland, or we're getting people from different countries to do jobs, or we're getting dentists from abroad because we can't get dentists in the National Health Service. The reason is a combination of factors. One, we're not able to call upon experts in the like plumbers or carpenters or whatever, because we're not training them. Now anybody, for example, like Paul Hardman or myself who worked in the mining industry will tell you that we had a brilliant training program for electricians, for mechanics, for all the skills that one can possibly think about. And it was known worldwide that if you were trained in the mining industry between 1947 and the 1980 period, you could get a job anywhere because your skill was of the highest order. Similarly, in the docks in Scotland, in Teesside, in Wales, all over where we built the best ships in the world, and in Belfast, all of which are now destroyed, finished. Those skills were sufficient to enable us to demonstrate that we could build for ourselves in the first place, but for worldwide, where they couldn't do it, in the second place, the kind of facilities that were desperately needed. We have got to face the fact that the crisis that we're now in has been created as a direct consequence of capitalism. Capitalism has only got one motivation, one driving force. Its engine is the acquisition of maximum profit at the fastest possible pace. And if it doesn't do that, then they'll not only sell off the family silver, they'll even sell off the family in order to achieve anything that represents an acquisition of personal profit. We've now got a situation where we've destroyed the mining industry to all intents and purposes on a false premise. How many people remember, for example, in 2008, the arguments that have been advanced that the real reason for closing collieries in Britain was because of environmental reasons, and that we needed to have a clean alternative energy policy? Well, those who advocated that policy ought to be put in jail for conspiracy, because the very opposite is the case. We're now importing 40 million tonnes of coal. But the coal that we're importing is substantially inferior in quality to the coal that we produce in the deep mines of Scotland, Wales and England. And it's costing the taxpayers of Britain billions each year on our balance of payments to purchase coal produced abroad to come into this country. It makes a profit for those who are doing it, but it destroys the economic well-being of the population as a whole. Nearly 70% of our steel, which was formerly produced in places like Sheffield, Scunthorpe, Teesside, Wales and Scotland, is now being brought in the form of imports.